joined in studio by Senator Stan Kutcher of Nova Scotia. He is a member of the committee that looked into the federal framework for suicide prevention. Senator, thank you for joining us today.
Well, thank you for having me join you.
So here we are, this framework roughly about 7 years old, and the conclusion of your committee is that in that time, it has not proven to work. In fact, this is a program, a framework that's supposed to prevent suicides from happening. But that is exactly what you're not seeing. So what's the failure here? Well,
first of all, let me commend government for wanting to address this problem, a very pernicious and difficult problem that touches the lives of so many Canadians, wherever they live, from coast to coast to coast. Commend them for wanting to do something about this, but also to recognize that doing something and doing the right thing are often different things. And the framework, as we discovered from our study, was not built around ensuring that the best available evidence for suicide prevention, whether that be public health interventions or clinical interventions, were being actually incorporated into the framework, were being evaluated and distributed widely so that they could be effectively scaled up. Instead, the framework was looking at and promoting interesting concepts, ideas that made people feel good about what they were doing, but really not hitting the nub of the issue, not using best available evidence to ensure that what was being done was working.
Now, this is obviously a huge problem, so I'm sure when you make that statement, you have a number of things in mind, but could you just give us one example of a best practice or a best theory that is not incorporated into the current framework?
Oh, certainly. Public health measures, such as means restriction. So very often, suicide is an impulsive act. It is something that people do in the height of a short-lived but very intensive emotional experience. And if they have access to lethal means at that time, they successfully complete suicide. If, however, access to lethal means is restricted, made more difficult, then it's much harder for them to complete the act. And when the impulse has subsided, they are more likely to take control and not complete the act. So one of the things I mentioned today was barriers on bridges. The fascinating work out of Toronto, which actually showed if you put barriers on the Bloor Viaduct, you really decrease the numbers of suicide there. Another issue that we're currently grappling with in Canada to try to get a better understanding of is how can we ensure we have responsible gun ownership merged with the reality that 70% of all deaths by firearms in Canada are not homicides, they're suicides. And they're predominantly men, and they're predominantly from rural regions. So how can we address that at a policy level and understanding level so that we support responsible gun ownership, but at the same time address suicide? So these are difficult challenges. The other thing that the framework didn't do, it didn't at all comment on clinical. And the clinical interventions, I was a clinician at one time, they are fundamental. Fundamental, because that's where the rubber hits the road for people who have a mental illness or who are in severe emotional discomfort and distress that come to a hospital. They didn't address that at all. And we know that there are effective ways that are clinical.
Now, I'm trying to think back a bit of the background to this framework, because certainly a few years ago, and people may have forgotten because of the pandemic, this country was dealing with a number of suicides, particularly amongst First Nations communities, particularly amongst communities in the North, and Inuit men and boys in particular. Was the framework rushed? Is that why there's this disconnect?
I can't answer for how the framework was developed, and I can't answer was it rushed or not. Senator Brazeau has spoken eloquently about this issue, and I completely agree with him. The highest rates of suicide are in the Inuit population, then in Indigenous populations, but there are huge variations between communities with high rates, communities with very low rates. And what we have seen from the framework is that it didn't prioritize where the need was the greatest. And so if we really want to make an impact on decreasing rates of suicide, we need to prioritize those areas where the rates are the highest. Because if we can address those and bring those down, they bring everything down. And as Senator Brazeau has pointed out, it's the Inuit population, Indigenous population, and men. Now, he correctly states about 70% of all suicides are men, often because they use more lethal means. So we have this conundrum of how do we help men, how do we decrease access to lethal means, and also how do we encourage men to reach out for help as opposed to doing the macho thing.
Leads me to the recommendations. There are 11 recommendations being made in this report. Probably not enough time to go through each and every one, but could you maybe talk to us about the spirit of these recommendations and perhaps broad stroke what you hope comes out of it?
Certainly, and thanks for that question. I think overall the committee felt that we had to ensure that the prevention framework was first and foremost grounded in the best available evidence, so that whatever else it does, it must ensure that we are putting into place the things that we know work. Secondly, that we are abstaining from using and investing in things that we know don't work. And thirdly,
example, just quickly.
Well, sure, programs at the community level to increase awareness about suicide. They don't work to prevent suicide. And if we don't know if something works, then we must invest in things that look promising and do the proper research, whether it's at the public health or clinical levels, to ensure that we know if it works. And if it works, scale it up. Let the provinces and territories, which are also part of addressing this issue, Indigenous, First Nations, nation to nation, they have to have a say and a leadership in this. Let's find out together what works, and then let's scale it up.
Okay, I have less than a minute here, but I do want to ask you, because when you talk about this framework not working, in this report you note the fact that the suicide rate has relatively been stable across 20 years. There's been no improvement in getting that number down. Have you talked to members of the Trudeau government? Have you talked to them about your findings, your committee work? I'm wondering what kind of initial reaction you're getting.
Certainly, good question. Actually, the Minister of Mental Health and Addictions, which is the first time we've had a minister in this country on that particular file, was a witness at the committee. She told us that she would like to see a report that was based on best available evidence. She committed to the committee that they would be reviewing the suicide prevention framework at CPAC, and that they would use our report to help them in their review. So I was very, very pleased by that kind of response from the minister. We will be sending the report to the minister and asking her for her response to the report, and we were also trying to meet with the minister so we could have a one-on-one conversation about where Canada can go as a federal government to actually address this vexatious and pernicious challenge.
Well, we will update the story as more information becomes available. Senator Kutcher, really appreciate the time. Thank you.
And thank you very much.